The President.
Orders of the day.
Notice of motion number 15, Deloitte Access Economics report, social and economic impact of electronic gaming machine reform use in Tasmania, resumption of debate. Ms Webb.
The Honourable Member for Nelson.
Thank you, Mr President. I'm pleased to resume my contribution on my motion, number 15 on the notice paper. We've been discussing the part of the motion B, which is going through a list of harm minimisation, in inverted commas, measures for poker machine regulation announced by the government on the 23rd of January. And the one that I was up to before the break was relating to allowing ATMs to be placed in gaming venues, Mr President. So let me speak a little bit about that one. The government, according to its announcement, plans to allow Pokies venues to host ATMs on site under the condition that they're fitted with facial recognition technology and have a $400 limit set for withdrawals every 24 hours. Now, Mr President, let's be very clear. There is literally no policy rationale for this measure whatsoever. No policy rationale. This would have been at the direct request of the industry. They've been trying to get permission to put ATMs in Pokies venues for years. They were incredibly upset when it was disallowed for that to happen and have been trying for years. And here's the government absolutely caving and giving in to industry. No one else would have recommended that this measure be adopted as part of a suite of measures. There is no research, no policy work, no modelling that would have indicated this, allowing ATMs in venues, is an appropriate step to take, or what impact that it could or couldn't have on harm reduction from poker machines in this state. Zero. I would suggest confidently that there is no way the Gaming Commission and commissioners would have recommended or advised this as a measure to adopt. In fact, I suspect they would have been horrified when they learnt of it. I'd feel confident in suggesting that the Gaming Commissioners would strongly advise against this, in fact, based on their previous decisions in this area when it comes to regulating poker machines and poker machine venues. Access to cash is clearly a risk factor, and that has been the basis on which ATMs have been banned from venues for many, many years. So did the government ask the Gaming Commissioners about this measure before deciding to adopt it? No. The Treasurer has confirmed that the Gaming Commissioners were not consulted with prior to a Cabinet decision. Nor would I suggest, again with absolute confidence, would Anglicare Tasmania have suggested or advised that this ATM measure be pursued. Quite the opposite, I would say, on that front too. I think there is zero chance that Anglicare would have said this wasn't a way to go, that this would have anything but a negative impact when it comes to pokies harm in this state. And I don't presume to verbal the Commissioners or Anglicare. I'm basing that off their previous positions very clearly stated on these matters. And they are quite able to disabuse me of this if it's not correct. Mr President, this is definitely yet another example of the government capitulating to industry demands to serve industry best interests and to literally do nothing when it comes to harm minimisation. ATMs have been prohibited from Tasmanian gaming venues for many, many years because under our current coin-based system, ready access to cash on the premises increases losses and harm. The only access to cash in venues currently is through EFTPOS, and that has been limited to $200 per day. And it's interesting, Mr President, just as a side note, it's very interesting. I don't frequent pokies venues, I make a point not to, but the last time, a number of years ago now, that I was in having a meal in a venue that had poker machines, what I experienced, and I presume is common practice in pokies venues, is that when I went up to order my meal and pay for it, I was asked, would you like cash out as well? And then when I went up later to get a drink at the bar, I was asked when I paid for the drink, would you like cash out as well? Now that looks to me, Mr President, very much like the McDonald's model of upselling. Would you like fries with that? So when you're in a pokies venue and you're buying a meal or you're buying a drink, you're asked, would you like cash out as well? Which is basically, would you like pokies with that? That's what that means in that venue, Mr President. Absolutely disgusting, actually, the pushing towards getting cash out in order to spend in poker machines in the venue. So that's the current system. EFTPOS, limited to $200 a day. Thank goodness there's a limit there. So it's not clear whether the proposed TITO system, ticket in, ticket out, that the government's putting forward is going to be moving us completely away from cash, whether, for example, the vending machine dispensing the tickets will take cards or cash or both when you're purchasing your tickets, who knows? No detail because the policy work hasn't been done. If ATMs are to be allowed into venues, it should not be until after a complete switch away from any cash-based system to, ideally, a card-based system, which, of course, Mr President, as on every other front, a player card system absolutely gets rid of the risk here. It would not matter if there was an ATM on the venue if we have a card-based system, I don't think. This is the situation where we are looking at any other option being likely to be increasing harm. The only way this proposal to introduce ATMs to venues can be regarded as remotely safe is if we were to go to that card-based system. It's also quite astonishing because there really hadn't been much thought that I observed in the briefing I had and the questions I asked to how this was all going to intersect with each other. So is it $400 at the ATM and $200 at the EFTPOS, or are we talking that we need to confine it to $400 across the two systems? Is it going to then be $600 actually across both systems? Not quite sure. Probably will be though. Probably be $600 you can access now in a venue through both those systems, which, as I said, just opens us up to greater harm actually to be inflicted on Tasmanians in these venues. Mr President, there's no rationale for ATMs to be placed into venues other than they've been requested by the industry, presumably because there's an advantage to them. There's an advantage to them probably in their pokies business. There's probably other advantages to them in their businesses as well, no doubt. So, Mr President, the final measure in the government's list of announced measures on the 23rd of January related to the previously announced government policy to provide funding to Hospitality Tasmania to employ 3 gaming officers statewide. So this is not a new measure announced, it's just a reiteration of a previously announced measure. These roles are stated to have an educative and support function, working with venue staff to improve the ability of venues to manage their obligations, including the challenge of responding to people with signs of harmful gambling and addiction. Apparently, this is based on a model used in South Australia, although in the briefing that I had, the government's representatives couldn't identify why this model was chosen. In answer to a question taken on notice at the briefing, the answer that came back from the Treasurer claims this, and I'll quote, "South Australia's model provides a practical example of how gaming care officers can operate effectively alongside existing regulatory frameworks. Their experience demonstrates that those roles can support venue staff, improve awareness of gambling harm indicators and strengthen referral and support pathways." But, Mr President, the problem about that is the government cannot point to any specific evidence of those claims. Has the presence of gaming officers in South Australia been demonstrated to reduce harm in any way whatever? I don't believe so. I'm happy to have it pointed out to me, but I don't believe that's been demonstrated. When they say that it operates effectively alongside existing regulatory frameworks, I'm sure it does. Regulatory frameworks consistently across our country, except in Western Australia, consistently across our country fail to reduce harm, fail to protect consumers of poker machines. And so if these gaming officers work seamlessly alongside that existing failing system when it comes to harm minimisation, I'm not surprised that what we're going to see here is absolutely no impact from these officers once they're in place. Victoria has had similar liaison officers as a model in that state. There's no evidence there that this has helped reduce pokies harm, no evidence. It's not clear why these roles are not attached to the Gaming Commission, for example, rather than the peak industry body. It looks like a little gift of some extra staffing to the peak industry body, just to help them out maybe. Apparently, the rationale I've heard is that you can't put them with the Gaming Commission because the Gaming Commission is doing its regulatory role of the sector. We couldn't have it doing a capacity building training / support role as well, which is what these officers are supposed to be. I think that's rubbish. I think we have lots of other instances where there are entities responsible for both those things. You just create separate roles and have different areas of operation and reporting within your organisation to deal with that. When it comes to identifying and responding to people exhibiting signs of harmful gambling and addiction, our industry utterly fails at that, and it's hard not to think that that's really just a built-in design feature rather than an anomaly or something that's being done accidentally. It's not hard to see signs of harmful gambling, Mr. President, when people are lining up maybe at 8 a.m. in the morning outside your venue. There's a sign right there. How many people get turned away at the door, do you think, at that time, Mr. President, which would be responsible service of gambling to turn them away? No. I can't go to a bar with signs of intoxication and be served alcohol, Mr. President, but I can absolutely be exhibiting flagrant signs of gambling harm in a gaming venue here and be served gambling products. Absolutely, that happens every day in this state. Mr. President, the government has stated an intention to review this initiative of gaming officers after 3 years of it being implemented, and it's confirmed this will be an independent review, but it has not indicated the measures on which it would be assessed as successful or otherwise or being evaluated against. It's absolutely puzzling to me, Mr. President, why we would be readily committing to reviewing this measure, but completely objecting to the idea of evaluating and reviewing the new revamped exclusion scheme and facial recognition system that they've been putting in place also. Why does this warrant an evaluation and review after 3 years and the other system doesn't, given the other one is much more central to the actual experience of people, consumers, who are interacting with our poker machine industry? Maybe it's because an evaluation of this will somehow be helpful to the industry, no doubt. They'll get a pat on the back maybe from it after 3 years. So, Mr. President, that's the list of measures there in the motion under 1B. The government's purported harm minimisation suite of measures, which I absolutely refute as having any real meaningful relationship to genuine harm minimisation, certainly not harm prevention, absolutely marginal at best. Mr. President, the thing to really ask ourselves about this, with that suite of measures, there's a few questions we should ask ourselves. One is, who asked for it? Who asked for that measure to be put in place? I can guarantee you on every single one it would be industry. And I think on every single one you would not have any other stakeholder, credible stakeholder coming from another perspective, whether it's advocates in the gambling space, whether it's researchers, whether it's independent entities like the Gaming Commission. No one else would have asked for these measures. I think we have to ask ourselves, what's the evidence base for it? I've spoken to that on each of them. There is none that says meaningfully they'll be effective. I think we have to ask ourselves, was there consultation with our Gaming Commission on any of these? I don't believe there was. And we have to ask who's going to benefit when none of these work to reduce harm, Mr. President. And the answer to that's really clear. It's the industry. We would also ask ourselves as well, though, how on earth could any cabinet be presented with this suite of measures to approve with absolutely nothing to back it up and inform that decision to say this is a responsible way forward and then pass them? What cabinet could do that, Mr. President? The next part of the motion is a really simple part. It's noting Tasmania's annual poker machine losses for 2024-25, and that those losses totalled $193,908,165, which by my calculations is a decade-high level of losses in this state. And I'm going to add to that, Mr. President, because I've just had a quick look now in the year-to-date figures, because we have there's monthly figures provided on the Treasury website. And for 2025-26, so far on the monthly numbers coming through for 25-26, by my estimation, we're going to land over $200 million in losses this year. That's what we're tracking for, really clearly. That's going to be horrifying. I don't think we've been north of $200 million for a very long time when it comes to pokies losses in this state. And that's a trajectory we're on. It's an upward trajectory. It's not a plateauing trajectory. It's not a downward trajectory the way it was in the decade leading into COVID. We're on an upward trajectory. This is an issue that is only having increasing urgency to be properly addressed in this state, Mr. President, which is all the more horrifying then to think about what the government's proposing to do. Most of the measures announced by the government have nothing to do with harm minimisation. They're likely to potentially increase harm. In fact, by comparison, the player card with its mandatory loss limits, its effective built-in self-exclusion, its provision of real-time and accumulative data to the customer as well as to the state would provide effective customer protections and empowerment of the consumer, Mr. President. It would be effective in protecting us against money laundering. The evidence tells us that the Pokies card with loss limits is vastly better than any individual or cumulative measures that the government is putting forward here. The last part of the motion, Mr. President, calls on the government to confirm two things. They're really straightforward. So this is a completely uncontroversial motion in and of itself, Mr. President, because we're just noting things and people can provide their own reflections on the things we're noting. I've done that in my contribution. People won't necessarily agree with me. They'll have their own reflections to make, but we're reflecting on a few things, noting things, and this is the call at the end, calling on the government to confirm whether, one, modelling has been done on the social and economic impact of the government-announced measures, and two, whether prior to the decision to adopt the measures, the government obtained advice from the Tasmanian Liquor and Gaming Commission on the effectiveness of the announced measures to prevent or reduce harm from poker machines. And to prevent potential quibbling, technical quibbling, I think it's clear in that second one, what's meant by obtained advice from the Tasmanian Liquor and Gaming Commission is the Gaming Commission overseen by the three commissioners, including Chief Commissioner Jenny Cranston, was advice obtained from that Gaming Commission, not necessarily just people who happen to be located in Treasury somewhere near the Gaming Commission and responsible perhaps for administrative oversight of some of the staff that work for the Gaming Commission. So these are just two things to confirm. It should be really easy for the government to confirm it. They could do it in their contribution today, and that's done and dusted in terms of responding to the motion. That's why the motion's not remotely controversial to support. In fact, since I put this motion forward, some more information has come to light about the confirmation of some details there. So we already have most of that on the public record. But I would like that to be confirmed here by the government in their contribution on this parliamentary record, because I think it's really important for that to be very clear. Mr. President, my assertion has been all the way through there's no modelling that's been done on the social and economic impact of these announced measures, none. And they've been adopted in the complete absence of advice from the Tasmanian Gaming Commissioners on the effectiveness of the measures to prevent or reduce harm from poker machines. Absolutely. That's the confirmation I'm looking for. So, Mr. President, as I make my way towards drawing to a conclusion, let me sum this up. Poker machines can be made less addictive and less harmful. We know exactly how to do that. The Rockcliffe government continues to purposefully choose not to make poker machines less addictive and less harmful. For a brief time, that was not the case. When the policy to introduce a poker machine player card with programmed loss limits was adopted and development of the player card was underway, Tasmania was taking a nation-leading, evidence-based, expert-advised path on preventing and reducing addiction and harm from poker machines. That is now even more thoroughly confirmed by the government-commissioned Deloitte report published in January this year. However, this Rockcliffe government and every member of the Cabinet that approved the abandonment of the player card have turned away from the proven, positive, life-saving approach of the player card. They have thrown it in the bin and adopted in its place a farcical list of measures that will not, in any meaningful way, prevent addiction or harm from poker machines. This list of measures is not based on any research, policy development work, advice from the independent gaming commissioners or credible evidence. The social and economic impact of these measures has not been modelled and the government has not indicated any intention to do such modelling. despite the fact that they insisted that the player card couldn't continue without such modelling being done, which was why the Deloitte report, or certainly the reason given for the Deloitte report to be commissioned in the first place. The Rockcliffe government, Mr President, and every member of the Cabinet that approved the abandonment of the evidence-based, independently proven player card has done so at the behest of the vested interests of the pokies industry. Because other than those vested interests from the industry, there are literally no other stakeholders, independent experts or representative groups that would have suggested, requested or advised the abandonment of the card and the switch to the flawed measures announced. The pokies industry is a major donor to the Liberal Party, that is a matter of fact, most recently having provided a massive donation of $217,000 at last year's 2025 state election. It is literally impossible not to connect those dots, Mr President, because it could not be more blatantly obvious. This is state capture by vested interests, pure and simple. State capture is a type of systemic political corruption in which private interests significantly influence a state's decision-making processes to their own advantage. With its capitulation and coming to heel for the pokies industry, the Rockcliffe Liberal government has provided a textbook example of state capture. We have a clearly understood, documented and studied public health issue of addiction to poker machines, which is harming thousands of Tasmanians. It's destroying lives, it's crippling futures at considerable cost to our state at a time of budget crisis. We know exactly how to address this public health issue and the harm caused at comparatively very little cost to the public purse. The player card with programmed loss limits is the solution. This Rockcliffe government and every minister in it is deliberately choosing to throw away that policy, to abandon the thousands of Tasmanians affected and the thousands more that will continue to become addicted into the future. There is no evidence whatsoever to support the abandonment of the player card, no trigger to do so, other than what we can surmise to be the direct request or demand of the vested interests of the pokies industry. In addition to the mountain of existing evidence, the Deloitte report provides every reason, social, economic, health, community, every reason to stick with the policy of introducing a player card with programmed loss limits. Instead, replacement measures have been doctored up at the direction of the pokies industry and announced with no evidence whatsoever to back them as the best way forward. In fact, so little policy work has been done on those announced measures, the centrepiece of it all, the TITO system, has virtually no detail available on the specifics of its features. Now, not only is there no evidence to show the announced measures will make any meaningful improvement, the evidence broadly indicates some of the measures are likely to create greater harm than our current system. If this wasn't costing Tasmanian lives and futures every day, we would say this is a farcical, inept joke. But, Mr President, it is far too cruel for that, because the Rockcliffe government and every Cabinet minister has bent to the will of donor vested interests at the expense of evidence-based public health policy. And here is what we can guarantee as a result. As a direct result of pokies harm, preventable pokies harm, there will continue to be Tasmanian children who will go hungry, who will be exposed to higher levels of domestic violence, who will have their families broken apart, whose families will become homeless and be added to our housing waiting list, who will develop their own mental health and trauma issues and struggle to stay engaged at school and build towards their own future. And here is the cruelest part, Mr President. Those children will grow up with higher levels of stress and trauma, and they will be more likely to live in lower socioeconomic suburbs where pokies venues are concentrated, both of which will significantly increase the risk that they have of developing an addiction to poker machines as an adult. Mr President, that is what we can guarantee as a result of the choice made by Premier Rockcliffe and his Cabinet ministers. And by the way, Mr President, the Labor Party policy is absolutely no better. The Labor Party is equally, if not more, captured by the pokies industry and operating under its direction when it comes to pokies policy. But it doesn't have to be this way. Instead, the Rockcliffe government, with the support of the Labor Party, could continue the policy of introducing a player card with programmed loss limits which evidence tells us will be highly effective in preventing and reducing a significant proportion of the addiction and harm Tasmanians experience from poker machines. The choice is there to make. There is still time to do the right thing here. I implore both the Rockcliffe Government and every Cabinet Minister in it to throw off the shady influence of Pokies' vested interests, which taints this government and this opposition, get back on the right side of history and continue implementing the player card that we had developed for our state, that was gold-plated, nation-leading. On that note, Mr President, I ask members to support this motion.